it is that time of year to get the kids in for their dental checkups, and it's just as important to make sure that they are getting enough sleep. But what do these two things have in common? Joining us now to talk about the connection of dentistry and sleep apnea is the dentist to the stars, Dr. Joel Gould. We should say, you know, we always say dentist to the stars. When we first met you, you're the dentist to Darth Vader. So
that's correct.
So you know what you're doing. All right.
There you go.
So, Doctor, first let's talk about this. You know, when we think about primary care physicians, we think about getting a health checkup. Dentist is probably not on that list. But you were saying just a few moments ago when we were in break, a dentist actually in many ways can function as a primary these days.
Well, that's true. These days what happens is most people have a relationship with their dentist. And in my case, I see the different generations of the family. I see the children, the parents, the grandparents. And instead of people coming in just to have a prescription when they have a problem, I see people on a regular basis. So I have a good idea of what their blood pressure is, what medications they're on. And when it comes to sleep apnea, everyone has this idea that it's an overweight person who doesn't take care of themselves. And what we see in dentistry is that when we tip people back in the chair and shine the light onto their mouth and their airway, we can see the signs of sleep apnea that can identify somebody who you wouldn't normally think would have sleep apnea. In this case, I actually have sleep apnea. And so we're identifying a whole different group of people by the intraoral signs, and there are some specific signs that we see.
Okay, so let's talk about the signs, but first, just in case someone is unfamiliar with what sleep apnea is, break that down for us.
Well, sleep apnea, the word apnea actually means without breath.
Okay.
And what this typically is, we're talking mostly about obstructive sleep apnea. Now, when it comes to sleep and breathing disorders, there's a spectrum, there's a range from the early beginnings of something called UARS, or upper airway resistance syndrome, and that's when you have decreased air coming in, to the end part of this disease, which is obstructive sleep apnea, which is when you fall asleep and part of your airway is actually occluded and you stop breathing.
Okay.
Now, sleep apnea, the definition is if somebody who stops breathing for 10 seconds or more. Wow. And in some cases, it's a lot longer. And what happens is when you stop breathing for that length of time, the amount of oxygen that's in your blood starts to decrease. Okay. And we measure 4% drops in oxygen. Now, if you held your breath for 3 minutes, you would not be able to get a 4% oxygen drop. So when we see that, that's significant.
Wow.
And when it comes to sleep apnea, we see people sometimes 30 times an hour having a 4% drop.
That's amazing.
Yeah, it's pretty incredible. And then what happens is when you stop breathing, as your oxygen gets lower, it starts to signal your brain, hey, I don't have enough oxygen. And you get the fight or flight reaction where you release a bunch of adrenaline into your bloodstream and it wakes you up. Now, it doesn't wake you up and you wake up and say, wow, I was just choking, although in some cases people do report that. Most frequently, you have these what we call arousals where you get woken up, but you're still asleep, you're still at a low level you're still asleep. And so this can happen over and over again, and what people don't realize is when they wake up and they're not feeling refreshed, it's because they've been under attack all night long.
Wow. So just to ask you really quick before we lose time on this, Doctor, when we are at our dentist, what can we do? If we've got a concern about this, we talk to our dentist about it? Can we say, hey, can you check this out? Is this something that most dentists can help diagnose?
No, this is something that's really new. And you know, modern American dentistry, I believe we're at the forefront of this. And dentists have a really good systems of continuing education. So we're really aware of this. And this is something that most dentists are becoming aware of. But it's something that this discussion and when we talk about it, it's going to be everywhere. And this is one of the largest healthcare crises affecting basically America and the Western world.
It's really amazing. All right. Well, guys, you heard it here first. Modern American Dentistry, they are on the forefront of this. Dr. Gould, we love having you on here. I mean, we could talk about this all day because this is really fascinating stuff. For more information on this, how you can get better sleep, also get a bright smile, and Modern American Dentistry, head over to CASA.com. Thanks for